Welcome to Uptime, the podcast from .med's Healthcare Business News, where we explore the people, technology, and ideas shaping healthcare technology management and clinical operations. I'm your host, Keri Stevens. Today, we're looking at a topic that's becoming increasingly central to healthcare delivery, and that's the shift from disconnected systems to connected ecosystems, and what that actually means in practice for hospitals and health systems. So to help unpack that, I'm joined by Dan Miles, the Vice President of IT at Intelas. Dan, thank you for joining me today.
Oh, thanks for having me. I'm looking forward to it.
We're so glad to have you. So to start, let's look at the big picture. Healthcare technology organizations have invested, healthcare organizations have invested heavily in technology over the past decade. With all of that, it seems difficult to get a complete real-time picture of what's happening across operations. So from your perspective, why does that visibility gap still exist?
Well, I think it's about, hospitals spending dollars for technology into different sections, right? And I'll give you an example, right? Like an IT department needs a cyber platform and they'll go out and they'll buy a platform that serves their needs. But biomedical field also needs to have cybersecurity in that area as well. So you end up with fragmented systems and fragmented data across the organization. So not having that in a consolidated view really puts decisions into which system are you looking at the time you're making that decision.
Great. And we're hearing more and more about the connected ecosystem instead of standalone solutions or print tools. So, what do you think is driving that shift right now? And why is it becoming so important in healthcare operations?
Well, I think it's around decision making and the capabilities that, there's a lot of pressure to reduce cost, improve patient care. And I think an ecosystem provides that real-time value across the entire organization where it brings all of that data together. So when you're making decisions, whether that's your CMMS, your EMR, cybersecurity, those you need a single source of truth, right? And when you bring all that data together, that ecosystem provides not only from an operational perspective, but it also provides from the C-suite level to make real decisions for a hospital. And that's really impactful.
No, absolutely. And so let's talk more about that, just how better connectivity between systems changes the way the HTM teams make decisions and prioritize their work, because I think that's the point.
Yeah. I think, the way they do it today, not having the complete ecosystem where, your asset tracking is in one, your BI analytics is in another, right? Not having them connected really is where I think it's you know, uh, a troublesome spot for people trying to make decisions and improve patient care, right? You want to be able to get change faster and be able to focus so that the clinicians are spending less time with tools and more time out with the patients.
Yeah, and I think especially something I've heard a lot lately is just about the silos and about how HTM teams and IT, they feel very siloed. Can you talk about that a little bit more?
Yeah, I think I'll give you an example, right?
Yeah.
You know, and I touched about this earlier, right? Like the IT team, they need to have connectivity for securing their network, right? But they're not really focused on, the CTs, the MRIs, those types of machines, right? Because their focus is on the network, and the biomeds and the ISEs, they're focused on the clinical assets. So I think having two different systems, not having everybody look at the same, view across all of the hospital. Like if you're in a CISO suite, right, you're focused on the network, but you're also focused on the biomedical side as well. So you have to have a system and a connectivity that shows you the complete end-to-end view. And I think an ecosystem provides that.
Let's get into cybersecurity now because that's such a big topic in HTM. What are some of the cyber concerns about not having the connectivity in a connected ecosystem?
So just kind of like what I was saying is, yeah, if the IT team sees that, hey, there's a vulnerability on a network router or switch, right? That network router or switch is plugged into, a healthcare asset that could, potentially be exposed with its own vulnerabilities, right? There's patches, there's things like that that come up. And so I think, having that in the end view really closes the gap for across the board. And that's really what the main issues are, as we see with our customers around our platform.
And yes, I'd like to get into that more. So when it goes wrong, let's talk about that more. When there's not connectivity, talk about more like the actual patient care implications, because I know there's a lot.
Yeah. So like a patient care is so like our technology and connectivity really allows for how fast is the clinicians able to get service requests, right? And so when you connect your EMR to your CMMS and you know what assets are being tied to which patients and when those assets need to be cleaned, right? There's automation and capability across the entire workflow that provides, faster response times from the biomeds inside the hospital. It reduces the amount of time clinicians have to spend tracking down equipment. They know exactly where it is when they need a fusion pump. All of that plays into the end-to-end operational efficiency. And that operational efficiency is a time saver, which then gives the clinicians more times to actually do the patient care. And that's really what, our customers are looking for.
And let's put a crystal ball. I definitely want to look in the future. So where do you see this going? So how do you see connected technology ecosystems shaping healthcare operations and asset management over the next few years?
So I think when I think about the connected data, right? That connected data is really the future of healthcare. If you have and you want to use AI, that AI component is only good at as the information that you provide to it. So if you have separate systems, right, that aren't talking together and the data is not mended, and you try to implement AI, right, a lot of hospitals are trying to do that. But if you really that data is really the key. It's not so much as the amount of data that you have for AI, it's that you have the right data to train that AI. And that AI then gives you technical workflows. It gives you asset management fully end to end. It allows for the automation of lower level tasks, right? That actually free up the clinician staff to be able to do more. So I think that's really, as we evolve, the future is not so much all of the data for AI, but the right data. And when you connect all that data together, that's really where you want to train those models to be more efficient and
Yeah,
ultimately, improve patient care.
for sure. And I definitely want to get to AI more. I think that's such a big topic, especially in HTM. And I think there's a lot of maybe confusion and just about like how it's going to impact the industry. So yeah, let's talk about that more. I think that's the most important thing to talk about right
Yeah,
now.
absolutely. I'll give you an example, right? Like there's all the training manuals that you go through to be an ISC. You got to get certified to be able to work on that equipment and all those details, right? So in a model of a completed ecosystem, if you take those events and you start with your monitoring capability, right? Are you bringing in the telemetry data on that CT? And so once you get that data in there, then you can start doing the what we call predictive failure. So we could actually look at that data, have AI analyze that, look at when do we think that device is going to fail. We can schedule a PM off hours for the hospital so it's not impacting patients where, the equipment is down. We could do it off hours. We perform the maintenance and we improve the uptime of that equipment. So that's one area, that's one little area, but even further than that, in a technology ecosystem, and we have a product called Tech Connect. And in that product, what we do is we allow the clinician to actually speak the issue. So you don't have to text it. You don't have to go back to the nurse's station. They could talk to it. And then once they talk to it, that ticket goes into our CMMS system, and the AI actually analyzes that request. It knows what assets they are. Is it a biomed piece of equipment? Is it an imaging piece of equipment? And it will actually give recommended repair guidance to a technician. So if a technician has to go to, the sixth floor of a hospital, they may need a part, but the biomed shop's in the basement, right? So when, they're going up and down the elevator, but if we could tell them, hey, AI says these are the couple parts you need. When they show up and they take those parts with them, that improves the first fix rate. So you actually are servicing the clinicians better from a technology perspective, just with that little bit of change of having AI do that analysis for you.
Well, what would you say to the detractors that, AI is going to take over your job? Let's get into that because I think that's a fear that people have.
Well, I think from my perspective, being in IT, right? I've been around a long time. There's been an evolution of IT stuff, right? So I think AI is going to be very useful at providing detailed analysis that allows the humans to be able to actually perform the work. Like AI is not going to go out and change a tube, right? Like there's just things that it's not going to be able to do from a technical perspective where you have to have that physical touch. But what it is going to do is it's going to enhance the capabilities of those technicians to actually provide more guidance. And over time, when you continually train those models, right? They're gonna get better. It's gonna get better and better. So I think that's really where the power of AI, and if you're leveraging it correctly and you put the proper guardrails in place, I think a lot of the AI hysteria is really um, by a lack of really understanding the technology and being somebody that's from the technology. I like to hear people talk about it like, oh, it's going to take my job. I'm never going to be able to do this again. But the reality of it is, I think people are going to work better and more efficient from the technology, is my view.
I think the issue now, it's almost like a wild, wild west with AI. It's like people, you know, they're just still trying to figure out how to get used to it, especially people that have been in their careers for a while. I mean, it's a tool, but it's also the wild, wild west. So what do you have to say about that?
Yeah, well, I think it could be. Like for us, it's more of a refined approach, and understanding where is it could it be the most impactful for our customers, right? Because I think the connected data is really the key. That data being analyzed allows better decision making. And you can run models and ask the AI, hey, what about this decision? And it can go through that analysis for you. So you don't have to go stub your toe, go buy a $10 million piece of equipment and find out that you don't have the utilization in your hospital, but you just spent $10 million on a piece of equipment that you may not, your rate of return may not come back for the next 10 years. Right. So that those models and that AI gives you the efficiency. And then, that's really why I think the difference is how we do it versus maybe some others.
I have two more questions. The first is what excites you most about technology in the HTM space right now?
It 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 is, I believe, in the next 3 years, the technology is gonna be great for the industry, right? The roadmap, the capabilities, who can leverage AI the best, who can provide their customers with the seamless interactions with technicians. If you could, get a voice activated AI in the hands of clinicians, right? Or in the hands of your technicians to do diagnostics for you. All of that capability. I'm super excited about the technology in the industry. I think it's going to be revolutionary.
That's great. Well, my last question, this is kind of the flip side to that, and it's what I ask all my guests as the last question. So what is keeping you up at night about in the HTM space, and specifically probably because you come from a tech perspective?
I think for me, I probably not that much, but I bet our technicians. I think the one of the struggles is the amount of technology change. Can the business absorb, right? Can the technicians that have been turning the wrenches, looking at manuals, can they change to doing things differently? And I think the faster technology is, the more harder it is for people to absorb. And I think that's one of the detractors that we're going to see. So how do you train them in a way and energize them in a way that this is really going to be helpful as opposed to those detractors that you were talking about, right? People are afraid of it. I don't want to use it, right? So I think that's really one of the things that can they Can the operations and business absorb the technology fast enough to leverage it to the best of its ability?
Well, that's a great place to leave it. Thanks again, Dan, for this wonderful conversation. And to our listeners, thanks as always. And if you enjoyed this episode, make sure to subscribe so you don't miss out on future conversations on the evolving healthcare technology landscape. Take care.
Thanks, Gary.